excited today. We have a very important topic to address, which is data management for clinical trials. For that, we have two experts, local experts, to really share their expertise and knowledge with everyone. So I'm very excited to welcome them both. We have Dr. Isabelle Fortier. She is a researcher at the RI-MUHC, and she leads the Maelstrom Research platform, which provides the international research community with expertise, methods, and software to support data harmonization and integration across studies. She also serves as a coordinator of data harmonization for several international initiatives, which include the BioShare project. This is the biobank standardization for harmonization for research excellence in the European Union. Nationally, she's contributed to the development of quality control and harmonization of numerous cohorts, including the Canadian Longitudinal Study on Aging, Cartagene, and the Canadian Partnership for Tomorrow project. Rita Wissa works together with Dr. Fortier as the Executive Director of the Maelstrom Research. She oversees operations, offered services, and strategic development of the project. She has also coordinated numerous national and international data harmonization cataloging. With that, I'm very pleased to pass the floor on to our speakers.
Generally, we are talking about harmonization, but we will not today. The demand was really to talk about data management and development of questionnaire development studies. And I need that. Okay. So clinical research means chaos. You are collecting information of different type, different ways, different sources. You never know what will jump in when you receive data set. And so it can be particularly complex. Sometimes we work or we are in collaboration with project that will have an Excel file with 12 participants and 5 information. Sometimes you will have a complex infrastructure where you will have data collected at different places, stored at different places, with no necessarily access to individual participant data for the researcher using the data. So that can be particularly complex. But more and more what you need, and based on the FAIR principle, you need data that is findable. You need data that is accessible, interoperable, and reusable. All that to be able to optimize your use of the data. You need to understand your data set that you're using. And you need, because perhaps you think that your postdoc will work on that and that will be the end of the data set, but that's never true. Someone somewhere in 2 years will want to have access to the data and will find the data that is completely impossible to understand. So you need to build it well, even if you think it's a short-term project. So it's always the same story. You have an idea, you build your grant, you hope for success, takes 6 months and you are rich, or more, 6 years and you're rich. But hopefully you finish by having the fun to do the initiative. Then you will work on the implementation, build your questionnaire, build your data collection infrastructure, develop the data management plan, all that to be then able to start. Then you will collect the data and link data, perhaps that are coming from different sources, integrate everything, ensure quality, and then you will be able to work on the analysis and write papers. But across all those steps, you need to think about the data. Even when you build your grant application, you need to put a budget that is, the right one, that will allow to manage properly and document properly your data set. And it's the same at each of the steps of the process. So the other thing you need to think of is the structure. of your data infrastructure. So you will collect perhaps with REDCap, but REDCap is not for statistical analysis. REDCap is for data collection, and that's it. Then you will probably have to extract data from REDCap and perhaps link data from different sources. So you will have your questionnaire data coming from REDCap. Then you receive environmental exposure or clinical information that you will need to link in another environment that can be R, that it can be another software. To analyze, perhaps it will be the same environment where you store the data, but generally it's a copy of the data set that you will use and analyze. But you can also have the need to disseminate information about your data set. So have a data portal that will allow people to learn about your data set and eventually ask for access to the data. And across all that, you need to manage the access. The postdoc that is quit need to be cut the access. You need to follow who is accessing to what, because when we are talking about security, it's not the security of R or the security of the server generally that is the problem. It's the way people are using the infrastructure. 2 weeks ago, I shouldn't say that, but we receive a data set by email with the name of the patient 2 weeks ago. And so it's not the problem of the server, it's not the problem of R, it's the problem of the person that didn't think and send us. It's okay, but so to make sure that everything is working well, you need a data management plan. I will not pass into the detail, but you have here an email, and we can share the slides after. Where not an email, sorry, a link where you can go to have information about the structure of the data management plan. But you need to think, who will access the data? How will I manage the giving or getting rid of the access? So each month, someone needs to pass through the list of the people accessing the data and make sure it's the right people, because we forget. And where do you store? Will you need a server or not? All those things often are not think of early enough in the process. So you at the end wake up and see that you don't have enough money and enough time to do it properly. So we will not, we don't have enough time, so we will not pass too much time in that, but you can contact us if you have additional question. But I wanted to pass a couple of minutes to talk about the questionnaire. Whoa, sorry. Okay. First thing, please don't change your question in the middle of your data collection, please. Sometimes you have to, and you have no choice, and Rita will give example, but here you have an example for CANPA. CANPA, they have 300,000 participants. They started with the long version of the International Physical Activity Questionnaire, 27 questions. For the first 100,000 participants, they used that questionnaire, but the participants were complaining because it was a little bit too long. So I was in a meeting somewhere, don't remember when, but a new PI in the group said, I know better. We will use the short form, and it is the same. And someone in the room said, you're sure it's the same? Yes, it is the same. We will do the short form, I know. So they all changed for the short form, but it's not equivalent. So now they have 100,000 participants with one version and 200,000 participants with another version. And as you see, the distribution with the long and the short form is not the same. the long form, your level of physical activity is higher than with the short form. But it's every day that we see stories like that. So more simple, sorry, I have really problems with it. Okay, more simple example. If you are asking a question about birth rank, would you like, what is your birth rank and a number? Or the study 2 that is asking how many of your biological siblings are older than you, including those who have died, siblings older than you, prefer not to answer, don't know, and specification, do not count the step sibling or adoptive sibling if you are part of a multiple blood, blah, blah, blah. Which one would you choose? That one is more precise. But if you have all the questions in your questionnaire with lots of specification like that, after 20 minutes, the participant that is reading all those things will be like, I have enough of that questionnaire, and will skip the information and will not necessarily give the high level quality information. So that is not enough. That is perhaps too much, and perhaps you need something in the middle where you ask the question, but not specification, or less specification, but keep it simple as much as possible. Okay, another example of Canva. There were a lot of discussion about collecting information about alcohol intake. And you had 3 choices at the end in the discussion. The first one was you had the same for red wine, white wine, etc., beer, etc. But the idea was to have the number of drink in a typical week. The other choice was having the number of drink on weekdays, Sunday to Thursday, and during the weekends, Friday to Saturday. And the other choice was last week, the number of drink on last Monday, last Tuesday, last Wednesday, etc. Which one do you think they chose? Sorry? Yeah, they chose the middle one, but the same arrived. So the participants were all mixed up because, you know, Sunday to Thursday, the weekend, Sunday to Thursday, they were mixed up with the definition of the weekend. So at the end, they decided to go back to the first one. Again, in the middle of the data collection, but that's another story. And using the more detail is better because it's perhaps more precise, but at the end of the day, again, here, it's if you're in the middle of, you know, it's Christmas time and you ask last Monday and last Thursday, the information will not be the same as if you ask it at another moment.
There must have been a proper pilot, that implementation pilot that that tells you which one works, which is not too long, which is too short. The mega study.
You don't, but each day we see studies, they don't have enough money to do proper pilot. They just think that they can write a questionnaire and start the day after and collect information.
CHR will, and
yes, CHR is without studies that are doing that each day. That's what we see in the in many of the projects we're working. I'm not saying it's always the case, and your project, I'm sure, are solid, but it's the piloting phase sometimes is not good enough. So it's really important. And Rita will give other example of that. Other real example. Again, all that is real. Different ways to ask questions, like that one, I like it a lot. Pain in breast, no right, left, new. Here we have several information. Is pain in breast, yes or no? If yes, right or left? If less, is it, when is the onset? If, same thing. This one, quantity of the number of hours. So 2 to 5, 5 to 10, 10 to, you have an overlap. So I can have 5 and answer that, and you can have 5 and answer that. So you need to make sure that there is no overlap with your categories. That one, it was a long time ago, but it's my error. It was the family income, and 40 and more. I had half of the participants that were with the 40,000 and more. So that I should have added the additional categories. The open text, please. You have nothing to do. What is your job title? I work with my father on the Sunday, and my sister is really kind. Okay, well, what can you do with that? But often people will keep open some of the information that is collected. And perhaps the last one, the timing as well. In the last month or since January, if, the recruitment is done through a year, you don't ask since January, because your first participant, it will be 1 month, but the participant 100, it will be 6 months in January. So the standards. Here you have example of the ethnicity, which standard to use. And we can take the, Statistic Canada have a really, really, really good questionnaire on ethnicity. It's 25 pages. So it's the standard. Okay, 25 pages, but you need one question to have an idea of the ethnicity. It's not the standard. And if you look at the ways questions about ethnicity are asked by different studies, and as well the categories, here you have Arab, West Asian, there you have Arab and West Asian together. So what is the category I need to use to have valid information? You can go on the Maelstrom website and you will have example, but for the standard, you need to sit down and think about what you want for your given study. So it's you need clear steps. And like mentioned, yes, rigorous validation, but even before, you need to sit down and think about what is your research question. Oh yeah, and we will add that, and we will add that, and we will add those information as well. Yeah, but it's not relevant for your research question, and you add the half an hour of data collection that is not relevant. So what is your objective? Determine as well when the information will be collected, who will answer the questionnaire. Will it be the prevalence will be high enough, the relevance, the impact on the participant. But most importantly, don't write the questionnaire first. Do the list of the variable you need first. It's more easier to think about everything. And there I can give an example. I worked on a survey. I was not the author, but they collected information on the asthma on children, phone survey. They asked question about passive exposure to smoke at home, outside home, all that information, but they never think about asking information about if the children were allergic to cat and dogs, and if they had cat and dogs. So when they analyzed the data, you had asthmatic children, but you didn't know those information that were key to the research question. So if you list the list of variables first, then you ask the question, it will be easier, more neutral way to jump in the writing of the question. And there, I will not pass through it, but there is a checklist that you, again, if you have the slide, just to think about ideas of, things to keep in mind when you write your questionnaire. So make sure that categories are mutually exclusive, the distribution of the participant is adequate, things like that, that can be helpful. So I will pass the.
All right. So just like we went through question examples, I'll go through examples that we faced while managing the data of some of the projects that we're collaborating on. But before getting into that, I'll say a few last words on the implementation phase that's clearly very important. Oops. Oh, I think it's because I'm holding it wrong. Okay. Voilà. So like Dr. Fortier mentioned, it's extremely helpful to list the questions in terms of variables. What are the variables that you're expecting, and in what format would you like to use them? So here's an example of lab measures. We knew that we were collecting data, lab data on participants, but the way we receive the data isn't necessarily the way that you'll be using it in your analyses. So perhaps in the end, what you want to know is if it's above a certain value, it means that it's a positive or a negative result. It doesn't mean that you're going to use it in the same way that you receive the data. So determining what it is that you're using, and maybe you want the values, but then making sure that you have the correct units. So you're anticipating how you're using the data later on. A type of variable that we often struggle with, it's a sneaky one, is all the date variables. Maybe you're collecting, day, month, year, but then when you open the data set in a different software to do your analyses, it decides to change the format into something else. So for example, if you open it in Excel, then it becomes like a numerical kind of series. Without getting into the technical details of that, it's just to say at every step, anticipate how you're expecting the format of your variables to be and get an idea of how you'll be using them so you could optimize data entry, but also statistical analyses. Okay. We talked about consistently asking questions through time. So we gave the example of the short form and the long form. So please don't change your questionnaires. This is another example where, unfortunately, they did change the questionnaires. So at baseline, so the question is, what type of cancer do you have? And it's a select all the types that apply to you. So at baseline, it was a select all, and we had the list of cancers available here. And then at the first follow-up, they slightly changed the list. Now we have skin melanoma, skin non-melanoma, whereas at baseline, it was just skin cancer. So it makes it challenging to see like the portrait of the patient data evolution. And on top of that, at the next follow-up, they also changed the format. So previously, it was a select all that apply to you. And then in the end, it's for each cancer type, do you have this cancer, yes or no? This might technically be a better way of asking the question. However, the fact that they changed it through the life course of the project makes it very difficult to, again, follow the evolution of the patient's data and to manage the data, because the way we manage missing values here is different than the way we would manage missing values when it's a select all that apply. In the first two waves, it's unclear, was the cancer not selected because they don't have that cancer, or because they skipped it, they misread it, they skipped the question altogether? It's not as explicit as saying, no, I don't have breast cancer, right? So you've validated your questionnaire, you've confirmed the format in which you want the variables. Now your next challenge is programming your questionnaire in your data collection tool. Here, we used REDCap for this project. And in REDCap, you have the option of saying that this form will be repeated. So we're going to have several time points for the same measurements. Extremely helpful, except when you're not expecting repeated measures. So for this project, we wanted lab measures at one time point. But the way it was programmed as a repeated measure. So when we did our first extraction, we were surprised to have an empty database. There were a few values, but a bunch of missing like empty rows and columns, because the way it was programmed was as a repeated measure when it wasn't. But then we have to investigate and see where these missing values come from. And then we figured out that it was REDCap. So now we have a script to deal with that with every extraction, but absolutely could have been avoided if we did proper testing. So the key message here is validate your questionnaires. Think about the format in which you want to use the data. Think about the story for all the patient data. So you might have subpopulations that have different measurements, like maybe some people have additional measures that are being taken on them. Think of the branching logic. So if somebody responded, yes, I'm a smoker, only they respond to the next questions of how many cigarettes a day do you smoke? Test, retest, and retest, and retest. Do a pilot of the questionnaires, of the programming, of the data collection tools, and make sure everything works as expected, and take the time to really do it, because it'll be save time in the end. As you'll see, it becomes extremely challenging to do any proper science with the data that's collected. So the implementation phase is extremely important, and it takes a group of different experts. You know, there's the ones conducting the research, and they're experts in their field. There's the experts who know how to build a secure infrastructure and to manage big data. There's the team that is the expert on the data management, and then the team that's, you know, an expert in the statistical analyses, and they all work together and make sure that everything is ready. All this before you even start collecting data. So now you've taken all the time and you've postponed your launch date a few times because you understand that it's extremely important to have it all right from the beginning, and you're in production mode. This phase is essentially, it's a continuous process of recruiting participants, collecting data, extracting the data, monitoring it, so making sure everything is okay, like we validate the content, prepare data sets, analyze the data, and so on and so forth until funding ends or until you've recruited the number of participants that you're expecting to recruit, etc. Moving forward, I'll focus on monitoring and preparing data sets. But essentially, with the study team, we determine how many times are we doing this? Is it like 4 times a year, twice a year? It depends on the needs of the project, but it's good to periodically do these data extractions and do a release of the data. And by release, I mean, it's taking a snapshot of what the database looks like at time X. So you have the participants that are recruited so far, the data, you make sure that that data is clean, you prepare the related documentation, you generate data quality reports, and then you use the proper naming convention to call that release. So if you've submitted a paper in, I don't know, like June 2025, and now we're in September and you have reviewer comments that you need to respond to, and you need to rerun your analyses with an additional 2 variables to respond to their comments, you're able to trace back which release was used for the results of this paper that you submitted. So these are the steps that need to be followed to ensure quality of the data at every release. You know, you validate the list of your participants, have any requested to be withdrawn from the study? Was there any loss of follow-up? How come? The list of variables, because again, the variables in your data collection tool is not necessarily the final list of variables that we're expecting in the database that's used for analyses. Generating univariate distributions for all variables, that kind of goes without saying. You check, you know, the mins, the maxes, the outliers, etc. And then we can cross-reference some variables that aren't necessarily part of a branching logic. So it's not just to make sure only smokers responded to number of cigarettes a day, but it's variables that could be related even if they're not necessarily part of that skip pattern. And then proper versioning systems. So now we'll go through the fun examples. Here we have sex at birth that we cross-checked with ever been pregnant. And we found that there were 147 people that were male at birth that were pregnant. And upon further investigation, we found out that it's because partners were sharing their emails. So it was, let's say, the male partner whose email was used, it was the female partner's email who was used, but it was the male who was responding to the questionnaire. So although questionnaire was validated, format of the variables were validated, programming the data collection tool was tested and retested, and everything went well, we still end up with discrepancies in our database for reasons that we can't always anticipate. So it's always good to do these cross checks. Another similar example, we have the question, what do you use to administer yourself insulin? If respondents answered insulin pump, a few questions later, logically, they should also respond with insulin pump to the question, what type of treatment do you use? So it's not necessarily a skip pattern, but it's logical to have the same response for these two different questions. At every data extraction, we do this cross-reference, and at every extraction, we find inconsistencies. So now what we do is we'll flag the participants with the inconsistent values, and we'll have a discussion with the study team. And this needs to be a rigorous process of determining what's the best way to move forward, because every decision you take can impact your database in the end differently. So it's a matter of figuring out where the problem comes from. Sometimes they know the answer. Sometimes they'll go back to the patients and confirm, is this what you meant to respond? Sometimes we don't have an answer, and then we need to decide, do we choose one over the other? Do we code them both as missing? But every decision needs to be thought of thoroughly, and the decision process should be consistent across all types of decisions and variables. That makes sense. Absolutely. Yes.
Because that's exactly what the NIH did when it recoded its sex and gender. Half of the places didn't actually document the fact that they changed the data, the variable names and stuff.
Yeah, you beat me to the punch. Documentation is super, 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 super key. But yes, every decision that's taken, there's always a different decision that could be taken. So it's important to document what was taken as a decision, why it was taken, so that whoever's using the data later understands what they're working with. Now, you might be thinking, oh, but that's because participants don't really know research and they're just responding whatever they're responding. But that's true for whether it's the research team who's inputting the data, or you're receiving data from labs who's, they're very scientific. But here we have HLA data. So we know that the values of these 6 columns are dependent on the values in the first 2 columns. And that's, we know from scientific expertise that was shared from the science team. So we use this figure as a reference to validate the values in these alleles. And again, every extraction, we find inconsistencies that we have to explore and investigate. And sometimes it could be because, there wasn't enough white blood cells in the sample that was used, so the values are inconclusive. That's okay. That needs to be documented. So whoever's using the data doesn't question it every time and knows that, okay, this is missing, not because it's supposed to be missing, but because it's inconclusive. And so with the data sets, we're also preparing all the documentation that goes with it. You might have a multi-centric project where you need to make sure that the protocols used are identical across all centers. So this is a simple one. Sitting height is kind of self-explanatory, right? It's the height from the participant's head to its buttock. And here, most of the centers forgot to subtract. They took the height from the head to the floor and forgot to subtract the height between the sitting chair to the floor. But when we first received this, since most of the centers had this correct, we thought, oh, maybe people from I don't know, Alberta or wherever are shorter, but I mean, it just seemed too consistent to be a fact, right? So then we had to investigate further and then talk to the data managers, talk to the people who collected the data, and then understand that, oh, no, most people just forgot to subtract exactly like 40 centimeters or so. So questionnaire might have been perfect. The instructions might have been perfectly written. The programming tool was perfect. Data collection went smoothly, but in the end, there's still like human error. The person inputting the data forgot to subtract something. And short time, okay. Yeah, so we mentioned, please do not change your questionnaires. However, sometimes it is necessary. For this project, one of their objectives is to evaluate the evaluate technologies and treatments in preventing hypoglycemic episodes. So when there's a new technology available on the market, naturally they need to study that. So what we decided to do as data managers was to do a release of the data. So now we know what a release is. We extract the data, clean it, and then name it. So we have the database at this time. And then we'll create new variables that have the additional new types of insulin pumps available. And so we're able to distinguish between the participants that had access to 6 pumps versus the participants who had access to 9 or 12 or whatever. And then in the end, it's up to the data analyst to decide, like whoever's doing the statistical analyses, to pull them or to not pull them, but they understand what differs between these sets of participants. So like we said, the data that you're collecting is not necessarily the end result of your database. Like you might have additional variables, or you might transform some variables. And if you're using REDCap, for example, as your data collection tool, the documentation around the variables are pretty complete. Like we have variable names, the labels, the categories, the category codes. Now, the same information needs to be provided for the variables that are derived by you or your team. So if we have, let's say, can somebody tell me what PH_2_score_HFSII_BEHAV? I'm not really sure, but this was a derived variable, and it was essentially the calculated score of the hypoglycemia fear survey behavior. But whoever is using your data later needs to understand what each variable is. So just don't neglect the documentation. Super important. To be ready to use your data, you prepare the data sets, and a lot of time is used in cleaning it and ensuring the quality of it. But a lot of time is also used in providing the proper documentation that goes with the data sets, and then generating data quality reports to support the fact that, this data is ready for use, and proper naming conventions to be able to version the data sets. So in the end, just ask yourself, can somebody else use this data, understand it, and analyze it and reuse it in 5 years? And if you have any doubts at all, go back to the implementation phase, run another pilot, make the proper changes, but it's worth postponing the launch of your data collection to ensure good quality data, because poor quality data just means poor quality science being made with that data, less impact, and it actually costs a lot more. Having low quality data costs a lot more in terms of efforts and costs. Here's just an idea of the distribution of time in a project. Data analysis, it's the red line. Blue is the data management. It takes a lot of time to properly clean and manage and ensure good quality data, but it's time well invested, and more good can come out of it. So key message. So we're Maelstrom. We do a lot more than like managing data, but that's how, with all this, that's how kind of we built that expertise. But we have a lot of tools, methods, expertise available for data harmonization, data management. If you need inspiration for questionnaires, or if there's a big cohort that you want to be compatible with when you're starting off a study, you can find inspiration in our metadata catalog where we document existing studies and their variables. And if you have any more questions, please don't hesitate to contact us. Here's our emails at the bottom. So, thank you.
And perhaps before the question, I would just add to what you said. What we see often is that the data are collected and you have the data set there, and the postdoc number 1 will pass 6 months to clean, and the postdoc number 2 will pass 7 months to clean, and so it's better to have someone that will clean, document, prepare the data set, and then you have people doing the analysis, then redoing the cleaning each time you want to write a paper. And that's so the structuring the data set, I think, should be done by one person, and then you have the user that are using the data or generating their specific thing.
It seems really obvious when we're giving examples, and it's like, oh, but that's so obvious that the emails shouldn't be shared between spouses or whatever it is. But in reality, I mean, you're writing protocols, you're going through ethics, you're hiring new staff or not, or you're working on your next grant application. There's a lot going on in day-to-day life that makes it so easy to neglect that one question in your big project. So that's why it often goes inaperçu. So thank you. It often goes unnoticed, but it's an accumulation of all these little things that make it difficult to work with later.
Well, thank you so much, Rita and Dr. Fortier. That was very insightful. And with that, I'm going to open the floor for questions. For those in the room, if you have a question, please use the mic. It's for the people online. Thank you. So, do we have any questions in the room?
Thank you for a wonderful presentation. I'm a statistician, and I used to work for the CLSA as what's called a data monkey, cleaning the data day in and day out, and I know how painful it can be when changes are made. And so with respect to the CLSA, this is a 20-year longitudinal study. How do you preempt changes to healthcare? Like, do you pre-specify that you're going to make changes in the future and document that ahead of time? Or do you just kind of roll with the changing landscape of healthcare in Canada? Like, what's the best way to account for this?
Sorry, I have an hearing impairment and I miss a little part of you. So the question is about the health administrative data? Yeah.
It's an example, right? It's a prospective study of 20 years. Things will change.
Yeah.
And so your data collection will have to change. Your surveys will have to change.
Yeah.
How do you manage that?
We need to think about harmonizing across collection. It's not harmonization is not just for different studies. It can be across follow-up. So, for example, and I know CLSA is working well and doing it well. So let's say you have, I don't know, ethnicity, the ethnicity question. Okay, perhaps at one point they will say, okay, First Nation, we should change or something. They can change, but they need to change it to be able to generate a variable that will be the same across all of the collection. So perhaps the question, and it's the example of Rita as well for the insulin pump. So at one point, perhaps the participant recruited after date X will have more categories for ethnicity than the other one before, but at least you can have one variable that will be the same for everybody. So you can analyze if you're interested in more refined categories for a subset of the participant. but you will still be able to have the analysis with all of the participants with less refined categories. And that's what we did for the cancer as well. We generated the brain, breast cancer, etc., with the yes, no, and presume no. So there are ways to generate harmonized variable across the data, the follow-up. But that you need to think properly, because if you just change your categories, perhaps you will not be able to generate that variable across the follow-up, and that can be a problem.
Just apropos your second last slide on those data variable names, impossible, and how are they passed on from one person to the other? No, this one, yeah. I mean, isn't that the role of a data dictionary for any data set? Do you even allow somebody to give you a data set without a data dictionary? Because then you start figuring out what the word S or the whatever any abbreviation is anywhere.
But that takes time that not all research teams have to properly document everything. So they kind of rely on, the current postdoc student who's doing the analysis. Yeah. They understand their own scripts, but they're not really thinking in terms of like a infrastructure a little bit.
And I was talking about fellows or postdoc that are doing analysis. So you will have a data set. Your first person statistician, no, because they know, so they will document well. But someone that is using the data, creating variables. And I always give the same example, but I had the cat. Yes, no. Is it I'm allergic to cat? I like cat, or I have a cat? You don't. So, so because you're in it and you're, a student and you need to do your paper, you will generate the variable rapidly and not take the time to document. And then you will finish, go away, and then the second person will pop up and say, oh, what is that variable? So we have... we develop, or no, I will talk about the harmonize, but we develop our packages for data harmonization, harmonize, and data, cleaning and documentation, MatShaper, that can be useful when you generate, because that's a way. You have an Excel file where you define everything. So that can be a way to make sure everything is well documented and well structured. It doesn't mean you need to use those packages, but documenting properly is really important.
I mean, even for the metadata catalog, when we're documenting existing studies, so it's not just like analyzing the data, it's these are the variables that we've collected. We often receive, no information really. Like, oh, we have the variable XYZ_36, and it's cat. So even documenting what's been collecting isn't always the case, unfortunately.
So that's where I don't understand, because if your service, this used to be before a sort of a per pay sort of for pay service. I know it's now included within core, but still, to me, if I give you a bunch of a big mess, not only is it unlikely you're going to be able to go through it, but I'll be paying a lot more. While if I give you an organized box of data, then it's going to be easier. Do you require certain formats or certain stuff to be done?
Yeah, like two things. If it's a mess, it's a mess. We will not receive mess and generate the perfect data set. There is we are not wizard. And yes, we're not part of Maelstrom is not part of core, but core is for the data collection and REDCap. So you can go with core to have some support. For Maelstrom, it's just we are developing methods, tools, and it's, offering the services for the data management. We are doing it, but it's not our main agenda. But it can be helpful, certainly, but absolutely. Cleaning a messy data set can take years. It can be quite expensive. So if it's well collected, well documented at the start, so that's why I spoke about data management plan. If it's think properly at the start, your life will be easy at the end. So yes, you will generate report for the participant distribution and do cross-check and etc. But it will take a week instead of taking a year.
Apropos the amount of time that it takes, do you already have AI-based methods that speed up this data cleaning?
We have the packages that automatically generate distributions and documentation and all that. That makes a lot of.
But that's R, right?
R,
that's just
R package.
R.
Yeah. But AI, no.
Yeah.
There is so many tiny decision, like how do we deal with the two information? Which one would we put to missing? Is it two? Is it? So we need to think at each step. And there is a judgment, I think that is really important, scientific thinking. If I put missing value here, it will influence the other one. So perhaps if it's a huge data set, but what we're working with, it's more human manageable data sets. And I prefer to have the procedure guided by someone thinking about quality and making sure the decisions are okay than to automatically generate. Like, it's the same thing. Often we have people coming to us and say, why do you harmonize? They give it to AI and they will generate the harmonized data set. But yes, they will generate the zeros and one, but that doesn't mean that the zero mean the same thing for each of the study.
Well, I think that nowadays people would never see it as being an either or. The idea with, and they are already existing even open source models where which are sort of agentic multi-step processes, which is what you have here, where every step is first given to review to a human, and then the next step proceeds. So it just saves time on doing the manual stuff, but there's always a human in the loop at each process. There's no question that that's necessary.
I mean, we do use some, like, for example, we know we want to generate smoking, so retrieve all the variables that are related to smoking. But then to evaluate the potential to generate or target variable, that's still like a member of our team who's going to do it. So we do try to use automated tools when we can, but we're not really there yet where we're just gonna feed it something and then have everything done for us.
No, I understand.
Yeah.
I was wondering, I imagine like for questionnaires, many of them have the same ethnicity question, age. Is it, I don't know, and I also know there's a lot of differences depending on the specialty of the questionnaire, but would it be an idea to have like on REDCap to like where everybody can just pick, like it's already ready and like question on age, and then it's automatically added, something like that. Make it easier for our
absolute
trialists and all research.
Two things. I did a review of 70 cohort studies in Canada collecting information about ethnicity. There is no standard. I tell you, there is no standard. The categories are different. The possibility to choose several or just one, you can select two ethnicities or just one. So sometimes you have multiple choice, sometimes no, and the categories offered, it's broad range. So a couple of years ago, I worked on the generic data schema, that's what it's called. That was 150 questions that were the question proposed to all new cohorts collecting. So smoking, yes, no, smoker, etc. You can add more information, but the idea was to be able to at least have those 100 information. We are talking with the Réseau Odyssée from FRQS, as well as with board, to work on a toolkit. You don't need to use and offer like ethnicity. Here is the categories we think should be okay, or smoking, yes, no, or level of education, what could be the categories, and that, you're right, can easily be added to REDCap and reuse. But we need funding and we need time to do that exercise. That's something I think is extremely important, extremely important. We did it several times in Maelstrom, but for specific networks. So, it's not the same question if it's a mother and child network, and if it's elderly aging cohort, if it's another network. So, but the exercise is important. And I think personally that at the RI core, we should have that list of variable accessible questions, and you can choose, oh no, I don't like it, I don't use it, but at least you don't think income, what can I collect information about income? You have an example or two examples of good ways to collect information. But for that, it needs time and it needs energy and it needs input from experts in different domains to be able to generate that. But I think it would be very useful.
Yeah, definitely. And if it's already programmed in REDCap, some people who don't have the capacity to, know how to do it with the conditional questions, it's already there, pick it.
Yeah.
It would be great for
this.
this.
And particularly often those questions are not the expertise, you're an expert in asthma, you don't necessarily know how to collect information about income, but you need that question in your questionnaire. So having access to those prepared, or I don't know, that are recognized as valid, I think would be a good asset for the investigator.
Thank you. Okay, with that, our time is up. Thank you so much to our speakers. It was really such an excellent presentation, and thank you all for joining us. Until next time.